a patient of rheumatic heart disease and his interaction with him. We have a patient here, 20 years male.
Rheumatic heart disease is actually a chronic heart disease, often seen in young people, usually when they are in their teens or early 20s, and the disease can be very disabling if it is severe.
क्या तकलीफ क्या होती है आपको? और कितने साल से होता है सांस का? 5 साल से.
If patient has severe mitral disease like mitral stenosis or mitral regurgitation, patients present with breathlessness on exertion. Sometimes it can go on to even breathlessness at rest if the disease is very severe. And they can also develop something called paroxysmal nocturnal dyspnea or PND. That means getting up at night because of severe dyspnea, and that's quite a hallmark of mitral stenosis of severe type. Then they can also get palpitations because their heart tends to be enlarged. So the moment they tend to do some work, they get palpitations because of more amount of blood flowing through the heart because of leaking of the valves. Mitral valve is the commonest valve that is involved, almost seen in 90% of cases, mitral valve involvement. It could be mitral regurgitation or mitral stenosis. Aortic valve is involved in about 20-25% of cases.
So on examination, basically he has a mid-diastolic murmur in apical area, and along with that there is a faint systolic murmur is present. So I am suspecting a rheumatic heart disease in this patient. So further I will be getting an echo done and further investigations. You can see this is a left ventricle. This is a mitral wall. This mitral wall, the tips are very thickened and calcified, and they are not at all opening. It should open properly so that the blood from left atrium to left ventricle should go. And this is the aortic valve, what we are seeing. This is also not opening properly, and there is some regurgitation. So now you can see this video, colored video, where there is a regurgitation in the aortic valve. There is a aortic regurgitation, what we say. This is moderate category, and we have a mitral valve where it is not at all opening properly. Okay, so this is the reason why he is having breathlessness and palpitations.
The treatment would be again secondary prophylaxis with penicillin, very important, simply because it will prevent further episodes of rheumatic fever and therefore will prevent further damage to the heart valve. The second part of treatment could be digoxin, diuretics, vasodilators, again depending upon the severity of the underlying heart disease. However, if patients are coming in congestive heart failure, then almost all of them would need surgery or some intervention. For example, for mitral stenosis, one can go ahead and do balloon valvuloplasty, which is a relatively less invasive procedure, but patients coming with valvular regurgitation like MR or aortic regurgitation, one needs to have a mitral valve surgery. Again, surgery can be repair of the valve, which is always preferred over a replacement of the valve, because replacement of the valve is done with a prosthetic valve, and that obviously requires anticoagulation on a long-term basis.